Dr. Malone, Joe Zarzaur here at the office. We were going to not do a update today because last week we were on YouTube live, I guess, and this week we were going to do maybe an update midweek or so, depending on what was going on. But we left the caveat in there that if something significant happened from a legal or medical standpoint, that we would come back on and pick your brain on what's happening. And then I heard sort of later afternoon that Pensacola had basically topped the charts as far as nursing home cases in the state and potentially in the country, with one particular nursing home here, Southern Oaks, I believe. Gregory and Coyle Street is where it's located, not far from here, actually, close to downtown. And they had 87 positive COVID patients, and then 15 or 17, I can't remember the number, staff.
15 staff members, yep.
15 staff members that tested positive. I think the place only has 200 to 220 capacity, right?
Yeah, and we don't know if they're at capacity right now or not, but it's 210 beds, and it's a mixture of what you call skilled nursing or short-term rehab, and also it's got an Alzheimer's unit and a couple of other levels of care offered at the facility.
And the most alarming part of these numbers is they're not, as you kept telling me, they're not cumulative. Right before we got on the air, you said they're not cumulative, which means there's 87 active resident cases, which means they have been diagnosed in recent days. And it's not over the last 6 weeks there have been 87 cases. There are 87 active live cases that have not played out yet, which is distressing for multiple reasons. You got a high risk group already, and you've got 87 cases of this that we don't know how are going to turn out, but we can tell that they're affecting high risk members of our community, which is crazy. And I guess you look at the total number of cases in these facilities for the state of Florida is somewhere around 1,100, and we've got 87 at one facility here. Who's watching the shop is what I'm thinking. From a medical standpoint, doctor, what does this mean for the number of ICU beds, the number of ventilators? We've got now a hot spot, if you will, just in that one facility in Pensacola.
Yep.
So, and obviously the staff who was working there at some point became infected too, and they likely brought it into the facility at some point. And I'm not sure how they were handling that on the front end. That's for somebody else to figure out later. But tell me what these numbers tell us.
Okay, so last week I had said a lot of how we're going to perhaps move forward is availability of ventilators and ICU beds and all that. So I've been keeping track of those numbers, and so again, as of this morning, the available beds and the available ventilators is like 176 out of the 220. Available hospital beds is just over 500 out of the 1,300 in the county. And you'd like to think, okay, yeah, like, do we have some bandwidth to maybe start opening things up? But then you get a report like this today that came out, and all along we've been trying to qualify every time, how many long-term care facility linked cases are there, and that's all we knew. We didn't know the breakdown. So the state released these numbers today, and you're right. It's I guess alarming more than anything to know that there are 87 current cases. And I'll mention that every time we've talked about hospitalized patients in the county, we've said, hey, there's 37 hospitalized patients, but that was starting from 0, basically middle of March. So that didn't mean there's 37 people in the hospital right now. It meant that over that period of time, 37 people had been through the hospital system in some capacity, whether they made it out or not. Either they've been discharged yet, or they're still receiving care, or unfortunately they did not survive the disease. So to know that cumulatively we've had 37 people hospitalized and we've been able to qualify it. Now we say we have 87 currently sick with this. That's alarming. and then to have the 15 staff members associated with it as well, you know, you like to think that the staff members are mobile, so they're coming and going.
Right.
So yeah, these residents very likely did not leave the facility in any way. So this was brought in, and probably, you know, continues to, or did continue to be brought in over a period of time before it was recognized, where back almost, I guess, 3 weeks now, where I said, hey, this is the most alarming thing that I've seen, where we jumped from, we had 8 in the county, and then we jumped up to 18, and then we jumped up to 39 in the course of a week. And I said, this is alarming. That caught my attention.
And all these nursing homes would have been put on notice when that nursing home in Washington State, and I guess, is it Everett or Everside? I can't remember the name of the town outside of Seattle, where
Kings County.
Kings County, they had the outbreak initially. All nursing homes in the country should have been on notice that this is a potential for you, and that these are tinder boxes, and you need to be taking extra precautions and all this kind of stuff. Despite all of that, there were still facilities that were reckless enough, I guess, or careless enough to allow this kind of outbreak. Now, when we signed off last week and we said we were going to just do these live conferences if we needed to, it seems like the number of positive cases in the county was somewhere around 200 to 300. Was that right?
Last Friday, 434, as of midday, we're at 470. And
470.
That was the jump over the weekend. Yeah.
All right.
And again, that is the cumulative. So that's a number we can qualify that, hey, we've had 470, not 470 currently sick or infected. But again, that's what makes this even more alarming, is 87 are currently infected.
Well, if you counted the 87 and the staff members, you got over 100 cases just from that one facility. Is that included in the 472 or not?
Yeah, I would. Well, you would imagine, because those were from yesterday's numbers that they calculated the 87. That was as recent as yesterday, and this number 470. They don't show the math on, you know, whether the 87 is inclusive of that 470, but based on the reporting criteria that's been laid out.
What was the number on Friday when we did the video on Friday afternoon?
For the long-term care facilities. So the long-term care facilities as of Friday was 143, and then today we're at 145. So it wasn't a big jump. So all along, that within that 140 and change, there's 87.
Okay.
Yeah, and we've always been asking, you know, every time I said that, you said, what's the breakdown? What's the breakdown? I said, we don't know that. We just know that they're identifying that there's 11 facilities in the county, but we didn't know which facility owned what amount of infections.
The facilities wanted a head start on the legal part of this. And so they lobbied somebody not to release their identity until they were able to get a head start on some of the damage control. Okay, that's my perspective on things. But that's, you know, maybe there's a different argument, I'm sure, but that's what I'm thinking. Obviously, these facilities are open up to all kinds of liability for this. In my opinion, they all should have been on high alert at the very beginning of this. They should have been, you know, making sure they tested the staff, kept the staff, you know, out unless they were for sure of their temperatures and they had the right PPE. And there should have been really, really, really tight controls on these places. That shows really a complete lack of control, in my opinion, and lack of oversight. That's what it looks like to me from here. And you've got Miami we're competing with, much larger metropolitan bases and cities that have higher elderly populations and populations in these facilities. And why are we in Pensacola the one that's dealing with the most cases? You know, it doesn't take a rocket scientist to figure this out, right? So I would encourage all the families of the people that have relatives in those facilities to ask a ton of questions and to make sure you get answers about your loved ones that are in those facilities. From a newsworthiness standpoint, I think this justified us sort of having this kind of update today. If you want to share, Dr. Malone, any other information you thought would be important to the local community?
Yeah, very quickly.
Zarzaur
So this is the document that was released today. And right at the top, the last sentence in the top paragraph says, the data is not cumulative, but reflects the information available for current residents and staff with cases as of yesterday's date. And this was published today, so it's yesterday. And so the total residents positive is 1168 in the state. And 87 of them are in Escambia County at one facility. And per capita, that's a pretty big
Unbelievable.
bang, like you said, compared to, so then you
But
scroll
look at
down
like
here.
Broward County. Broward County. I mean, the older population in Broward County, Florida. And look,
Yeah.
one of the biggest cases outbreaks they had was 39.
Yeah,
From
that's pretty much it. Yeah. So,
yeah, so we're double them, and they
here's the rest.
probably have three to
Actually,
four times the population.
yeah. So Broward, I just flipped to the next page. All the rest of them are either 0 or 1. So
Right.
yeah, Broward's biggest offender is 39. So to know that for our population, yeah, that's significant. I did pull some other information. I guess it's a historical look back for us in, let's see, here we go. So this is the county back Februari 27th, March 9th, the first one, right?
Right.
So we'll link this tonight for people if they want to digest this and kind of put themselves in these shoes. But there were 81 residents that ended up being tested positive at that facility, and 23 died.
All right, and we have 86 that tested positive. We have more than this place in King County, Washington, before they knew the virus was in the country.
Yeah, yeah.
So this facility in Washington State didn't even know the virus was in the country, and they did a better job than this place in Pensacola.
Yep.
Unbelievable.
And then the Canterbury facility up by Richmond, Virginia had 92 positive tests, and 16 people ended up dead. So I guess I'm not beating the drum of like saying, hey, like people are going to die, but
People are going to die. Let me say
a quarter of these
people
people
are
are not
die.
surviving. Yeah,
right.
a quarter of these people aren't surviving. So that's the scary thing. And that's, again, back when this thing jumped from 8 to 39 within the matter of a week and a half, I said, this isn't not good. So that's the part that scared me the most. And I guess it's the canary in the coal mine to a certain degree, meaning these people didn't leave the facility, it came into them, and it's a factor of something going on outside of the facility in our community. People aren't heeding the advice of the social distancing, things like that, or there's enforcements that aren't in place as far as basically stopping people from visiting and watching who the vendors are that go into the facilities, the employees, things like that. I will share with you. Go ahead.
And you got to wonder on the contact tracing side of this, I wonder if the facility has done that. I wonder if they've gone back in their records, if they even have records, which I doubt very seriously they have records that are reliable, but they've gone in and figured out, okay, this person tested positive, and during that week, this many people came from their families and to visit them and left, or this many people were in the facility delivering things for the facility, vendors and whoever else. I wonder if that's been done.
And
my hope is that somebody's done that, but my guess is just based on where we live and how we're not on top of things, it probably hadn't been done.
Yeah. So CDC put out a checklist, a couple weeks ago. I said, there was different recommendations or guidelines that state level and then federal level they're putting out. Center for Medicare and Medicaid they put out their own recommendations, and they all basically came back to follow the CDC guidelines. So here's a worksheet that these facilities were basically given. It's a checklist of things to do. And if you look at this column, it says completed, in progress, and not started. It said that the different steps they're supposed to go on: development of a written COVID-19 plan, the elements of the plan, and this was all there. So, I'd like to think that, if you're ownership or directorship of a facility, that this would be something that you embraced 3 weeks ago, because if not, it's going to get worse, much worse. So, yeah. And then lastly, I will share with you just kind of to put things in even more perspective, this is that state database that we pulled up, I guess maybe a few weeks ago now. And just don't pay attention to the total of all the cases and all stuff. Just pay attention to the counties. If I'm on the right-hand column over here that I'm moving, I just look at see those cases. Calhoun County, 6 cases. Citrus County, 97. We have one facility that has more than a lot of counties.
Wow. One facility in town. One
Yeah,
facility has more cases
than
than,
a lot of
than
counties.
most of these counties in Florida.
Yeah, just scroll down here. I mean,
That is a failure on behalf of that facility. A miserable failure on behalf of that
mhm,
facility. And you almost say they're being reckless with people's lives at this point.
yeah,
So, again, families of these people that are sick in that facility, you need to be asking 1,000 questions,
yep,
and you need answers to those questions. I would encourage
hmm
you to make sure you get answers, and I wish the best for your relatives. Dr. Malone, thank you for coming in tonight for this one. Given that this should make national news, I think it might make some national news tonight. In the event that it does, and in the event that this gets any worse, we'll be back as needed this week.
hmm
If you need to find us on the web about this or anything else that we do, personal injury wise, zarzaurlaw.com. You can find us, call us at 855-HIRE-JOE. Thank y'all very much for tuning in, and we'll see you again later this week. Thank you, Dr. Malone.